Now, if you know, you've been following the National Health Insurance. Of course, if you are a subscriber of the National Health Insurance Scheme, I'm sure you dread having to spend time in queues at registration centers or at hospitals trying to, renew your card, etc. And I can't even imagine how my grandmother does that. Well, seems that there's a new development, which may be good news depending on how it is implemented. We understand that the NHIA has introduced a new system that allows subscribers to renew their cards from the comfort of their homes, from the rooms of their side chicks, etc. And you can even do that in the farm because you do it on your phone. But how? I'm joined in the studio by Berima Sapong. He's the communications manager at the National Health Insurance Authority. He's going to tell us a bit more. Mr. Berima, you're welcome.
Thank you.
Okay, so this is exciting news. But of course, the devil is always in the detail. So you take us through it.
Let me say good afternoon to our cherished viewers. I think health is an issue for all, and it's important that we all take it seriously, because whether you are old or young, a man or woman, whether you're in party A or party B, you can be affected by one disease or the other. And so health insurance, as we all know, gives the accessibility to healthcare. We have in our data registered about 18 million Ghanaians or members of NHIS.
18 million?
18 million.
Okay,
but currently
so
we have close to 11 million active members. What that tells you is that there are a lot of people who have registered but have not renewed.
Right.
Because when you register, you need to go every year to renew it. Renewal, of course, has been very tedious. You have to go and wait in long queues, long days. Sometimes it takes a day or two because you'll be asked to go and come back and all that. Management and board of directors of NHIA, within the bigger vision of government and the President of the Republic, have come up with this National Health Insurance Mobile Renewal Service.
Okay.
And what this does is simple. This makes it possible for you to use just your phone, whether it is jam, plantain, smartphone, whatever it is. Okay. Use your phone to renew your membership.
Okay.
At the comfort of your home, at the comfort of your workplace, whether you're in the farm or market, wherever you are.
Or in your side chick's home. Okay, so break it down for us. If I have my phone, what do I do?
If you have your phone, you just have to dial *92#.
*92#.
And then it will take you onto the platform where you can check the validity of your membership, where you can check our benefit package, where you can check the medicines list and all that. So from there, it will take you through the process. But of course, you're going to have to pay your premium with your mobile money wallet.
Okay. How much is the premium?
Basically, 24 cedis.
24 cedis?
Yeah, 24 cedis.
You said basically 24 cedis.
I say that because depending on where you live, and this decision or policy has existed for long, depending on where you live, we have your premium being different.
Okay.
So people are paying 27 cedis, others are paying 24, others are paying 30. And then depending on the category in which you also fall, you may not even pay 24 cedis or 27 cedis. You may pay 5 cedis or just 8 cedis. So
okay, so the biggest amount you could pay is
the maximum you could pay is 30 cedis.
It's 30 cedis.
Yeah, the maximum.
So it ranges between 30 cedis to the range is
5 cedis to 30 cedis.
Oh, okay. So 5 to 30 cedis.
Because we have exempted groups.
Okay.
Yes.
Okay. So someone like me will pay how much?
Well, if you're a SNET contributor, then you're going to have to pay 5 cedis for renewal.
Okay.
Yes.
So of course I'm a SNET contributor, so I'll pay 5
cedis for renewal. If you are not,
my grandmother is not.
She's not. Is she over 70? If she's over 70, she's going to pay 5 cedis.
She'll pay 5 cedis.
Now let me be clear.
Okay.
If you are 18 years or below, you will pay 5 cedis. If you are a SNET contributor, a SNET pensioner, you pay 5 cedis.
Okay.
If you are over 70 years, you pay 5 cedis. If you are not, if you are a pregnant woman, you don't pay anything. And of course, if you are indigent, indigents are people who are, very, very, very poor and even benefit from LEAP and all those government interventions. You don't pay anything. So if you are not any of these categories, then you are going to have to pay the 27 cedis or the 30 cedis.
Okay.
Yeah.
So I'm going to run through this quickly for you. So if you're at home, give it a try, okay? And let us know if it's working. You can drop us a message on our Facebook platform. So it is hash 929, star 929 hash. Star 929 hash, and then you get to follow the prompts, and then you make a decision as to whether or not you want to pay, and it ranges between 35 cedis to 30 cedis.
30 cedis.
You want to put in a quick word?
Of course. We need to clarify a few things.
Okay.
This program has been piloted in Esojama and Mampusi districts, and we are about to roll it out nationwide this month. And so whoever does this star 929 hash will get onto the platform all right. But until we launch it, it will be launched by the president himself. Until we launch it. So it's
not been launched yet?
Yeah, it's not been launched yet.
So you can't try it?
You can try it. It will put you on the platform, but you can't go to the...
But you can't make the further... You can't take further actions?
That's it.
Okay.
But if you are in Mampusi or Sujama right now, you can try it and do it, because 21,500 people have done it through this platform.
But you're saying that it has to be launched first?
Yes, because that was just pilot. The pilot ends the very day we launch and we set out to the...
So, but the areas where you have the pilots, they've been able to use the system to renew their membership?
Yes, 21,500 people have used it successfully. And among these people, when we did a survey, 300 of them said that they are ready to recommend this for their families and friends. That's 100%. And about 98% said they are okay, or it is excellent when you are being authenticated at the provider end. Okay,
so you're confident after the pilots that this works very well and you're about to launch it. When is the president launching it?
Within this month, but let me leave the date for now because I'm not supposed to put it out. It will be put out very soon. What we can say about it...
But do you really need the president to launch this? If you're talking about making the system, a health system, efficient, I mean, making the health system efficient for Ghanaians, you set up this system. I mean, just go ahead. You've done the pilot. It's working. Why don't you just go ahead and roll it out? Let people have a feel of the innovation that's supposed to make the health delivery system efficient. Do we need to wait for the president to commission this?
Let's not make this a political conversation.
It is not.
But of course,
it is not. I'm just asking, and it's not even about politics. I'm saying that do we need the president?
No, I said that because of what I'm about to say.
Well,
yeah. Well. So this is not a political conversation. This is important because there's a government and a president who have promised to take NHIS from where it is to a better position. And among a lot of things that were promised, we have done a lot of them in the last 23 months. This is just one of them that we are about to launch.
So there is the politics, right?
No. we have e-receipting as well. We have electronic management of claims that is also coming up, because every insurance try on confidence, and you need to win confidence back into NHIA as promised.
That's all right. Yeah. So we're waiting for the president to commission this, and it's supposed to be within this month. You say
please.
This is December. So hopefully from next year, you won't have to go to the hospital. You won't have to go queue. You can do this in your home. You can do this on your phone. Just renew your health insurance. But is the health insurance working itself? Is it working? I mean, have we moved away from the days when you sent your card and you be rejected because someone else has money ready to pay cash on the spot?
Your question requires a whole period to discuss this.
I agree.
Because like I said,
up for me so that we can wrap up.
Said, any health insurance runs on confidence. In the last 23 months, we have tried to win back the confidence in NHIS, and we have done a number of things. Before you take your car to a health facility for it to be rejected, there must be a reason. Maybe NHIS is owning the facility that they are not paying, or they are paying but they are not paying on time. So if you are not paying on time, it means that the processes of claims management are very slow and they are manual. And this administration is doing something about it. We are doing what we call electronic management of claims. And again, we met claims that were unpaid. That also hurts confidence. We have paid over 27 months of claims as we speak. So definitely NHIS is better than it used to be. It's better that we met it.
Okay,
Yes.
I hear you. Your final words will be next month. This month people should expect to be able to try this with your mobile phones. Your final words on the NHIS.
My final words is that let all of us try and get onto NHIS. Let's all of us try and use this process because it saves us a lot of money. This saves the consumer a lot of money because you will not have to pay transportation to our district offices. On the average, we pay about 5 cedis to 9 cedis to be able to go to our offices and register. That's just for transportation. In this case, you're not going to have to pay that money. And so we think this will help. Everybody should try and adopt this system, and we'll move forward.
Okay.
And take care
I'm
of our
excited
health.
about it. I can't wait to take my grandmother through the system so that she can also renew, because she can't go and renew it. She just stay at home probably and buy paracetamol. But hopefully this will work. Thank you very much for coming.
You're welcome. Thanks to
Verima Sapong. He's a communications manager for the National Health Insurance Authority. I can't wait to go through this.